Hi, I'm Dr. Aaron Bates, your Ventura County Spine Authority, and welcome to DIY Guy. Today we're going to actually go over how to maintain and manage common problems during pregnancy. So it's not really DIY Guy, I guess, but DIY Gal? One of the problems with general health care is the way that we treat pregnancy. We almost treat it like it's a pathology, like it's a sickness, like it's something that we have to just kind of be bedridden for, when in reality it's the exact opposite. It's more like a marathon that we're training. Okay, the feet are one distance away from the wall, hip width apart. And if you watch my knees, I'm going to drop them down just a tad, just so that I can no longer see my feet while resting against the wall. My back is perfectly flat and my posture is upright. The next position is really important for gently mobilizing, not stretching, but gently mobilizing the low back and pelvis. Movement through labor and delivery in the pelvis is absolutely important for the little baby to work its way through the birthing canal. Position, the hands are right below the shoulders, shoulder width apart. The knees are right below the hips, hip width apart. And the spine is as straight as possible. The tummy is pulled in. And then the hips are gently just going to wiggle back and forth. Less of a stretch, more of a motion. This will hydrate the discs and joints, loosen up the muscles, and free up neurological pressure. Going up and down like a cat will traction the spine as long as we're keeping our navel to spine, holding the spine in. Holding the tummy into the spine, we can actually get a nice mobilization forward and backward. What we're going to go over is how to work the musculature of the sacroiliac joint. Probably the most common, not even 50%, probably 80% of the problems that I have pregnant women come into my office for is an SI joint problem. And the reason why is because there's so much complexity into the way the hips move, and throughout the pregnancy you're developing a hormone shift and change in a hormone known as relaxin, which literally loosens up the ligaments, creating an unstable back. Which I believe the best thing to do for the SI joint is going to be the lacrosse ball. You can also use a foam roller. It's very difficult to do it that way. A lot of people try to stretch out the hip, which actually, if you've ever heard me talk about stretching, especially for an unstable pelvis, that is the last thing you want to do. Do not stretch. So, ball is going to be placed underneath the SI joint. Be really careful for the sciatic nerve. You'll know if you hit the nerve because it'll let you know. And what you're going to do is just try to put a little external rotation into your hip. If you can't do this, don't worry about it. You can keep your foot flat, but it works better this way. And just gently work the lacrosse ball up and down the SI joint. Keep holding one spot is great. Try not to stretch it out, but again, just basically visualize like kind of mashing that tissue to soften it up a little bit.